In today's video, I'm going to go over a common condition we treat in my office, which is going to be tennis elbow. This is also called lateral epicondylitis, and what that is, it's when the muscles that extend your wrist, they attach right here in the elbow. And a lot of times this is caused by tennis, but anytime you're going to be gripping a lot or doing pickleball or any other treatments where you're going to be gripping intensively like that, that can cause the muscle to get tight, and then that causes the tendon to become inflamed, or it can become chronic in nature where that tendon starts to break down and create like a tendinopathy. And so what we're going to do is I'm going to demonstrate what a typical treatment looks like in my office when we're treating tennis elbow. One treatment technique we like to use when we're treating tennis elbow is going to be dry needling. So dry needling is a technique where we insert a acupuncture needle into any trigger points or knots in the muscle, which is going to help to loosen up that knot and take pressure off the tendon where it attaches in the elbow. So what I've already done is I went through Renee's arm here and felt where there are any knots or trigger points, like she has one right there, that I'm going to target. And again, this is to try to release the pressure on the tendon right up here. So what it's going to look like is I'm going to feel that spot. We're going to insert the acupuncture needle into the spot, and you can see her hand jumped right there. And what that was is we hit a knot or a trigger point in there that is causing some of that pressure on her elbow. So this will help to break up that tension and help relieve the pressure on the elbow. When we're performing dry needling, the needles are only in a few seconds. Once we get that twitch, they can be removed. And because they're about the thickness of a hair, there's no bleeding usually. Dry needling is a very effective treatment when we're treating tennis elbow, and it's one of the main techniques we use to help fix it. In addition to dry needling, two other techniques that we like to use are going to be Graston technique, where we take this Graston tool over the tissue to help loosen up any adhesions in the fascia and help take pressure off the elbow. And then the other one is going to be active release techniques, where I use my hands to help break up any of those adhesions or tightness in this area. So what the Graston technique is going to look like is we're going to apply a little emollient to the skin, which allows the tool to slide over the skin. And then I'm going to work the Graston tool up and down those wrist extensors, finding any areas that are tight. And what it'll feel like is when we get over a problem spot, it'll be kind of a little bumpy or gritty. And what we're doing is we're working that tissue to help loosen up that. It also increases the blood flow to the muscle and tendon, which helps that heal. Patients often respond to this. Feels like really good in this region when we get over a problem spot. It feels like we're working that tissue really well. It feels like that's the spot that needs to be released. And again, I feel like a little bumpiness or grittiness right there. And then I'm going to treat that section and then move on to the next one. This is nice if someone has a lot of discomfort when they're going through range of motion, because we just have to keep the palm flat, and so we don't have to put it through range of motion while we're doing that. So this is what Graston technique looks like when we're treating tennis elbow. The other hands-on technique we use to treat tennis elbow is going to be active release technique. So with active release technique, what we're going to do is we're going to shorten the muscle, and then we're going to lengthen the muscle. So what it's going to look like, Renee, I'm going to have you hold your wrist back like that, and then I want you to bend your wrist and then straighten your elbow. Good. And bring it back up, and do it again. And we're just actively putting it through a range of motion while I contact that tissue to help stretch it out. And again, a lot of times this feels like kind of hurts good. It feels like you're getting in the right spot. So what we're going to do is we're going to work that whole tissue all the way down, depending on where the issue is. But most of her issue, and most people, the problem spot is going to be about 2-inch window in through this section. Maybe down more here, maybe up here. But we're going to kind of treat that area as typically the problem spot. For really chronic or difficult cases of tennis elbow, we use a technique called focus shock wave, which sends an acoustic sound wave into the tissue to help break up any adhesions or scar tissue in there. This works really well if you develop like a tendinopathy, which is a weakening of the tendon or fraying of the tendon itself. And this will help to regenerate that tissue, help to break up any of those adhesions, and increase the blood flow so the tendon can heal. What we're going to do is we're going to apply the shockwave probe over the area. What's great about this technique is also diagnostic. So what I mean by that is when we get to the problem spot, it's going to feel like a deep, dull ache for the patient. And then when we go over a normal muscle, they're not going to feel much. Now in her situation, the problem spot is going to be right up in here. And again, what you'll feel is a little bit of achiness, and then we get on the problem spot and it feels like a deep, dull ache. And that's where we want to concentrate the treatment at. And this is great because it gets very deep, sometimes deeper than, say, the dry needling or the Graston or active release technique. And we like to work this technique for real chronic conditions. This will help to fix that and get that tissue to heal. So focused shockwave is a great treatment if you're dealing with chronic tennis elbow. I highly recommend it.